Ruby. I'm an Admiral nurse and I work in the Closer to Home Clinic's Admiral service. I'm here to talk to you today about Dementia UK's core clinical services. Um, I am a general nurse by background. I registered as a general nurse in 2011. The majority of my career has been supporting older adults in the hospital setting, and the majority of that supporting people with dementia and their families whilst they were in hospitals. In 2020, I had the opportunity an Admiral nurse post came out local to me, and it was a clinic service in Chesterfield. And becoming an Admiral nurse is something that I'd always wanted to do, and I became an Admiral nurse in 2020. I started my journey with Dementia UK and Admiral nursing in a regional clinic, which was in Chesterfield. I now work within the Closer to Home Clinic's Admiral nurse service, and I also support helpline and virtual clinics. So I'm hoping to share with you today information about what we call Dementia UK's core clinical services. And by that, I mean the support that we offer through the helpline and the clinic service. And I'd just like to give you some background and some history about how those services were started, and to demonstrate to you really how Dementia UK are committed to ongoing development and adjusting our services to meet the needs of people with dementia and their families. So I would like to start off by talking about our helpline, and the Admiral nurses are dementia specialist nurses, and they provide life-changing support for people with dementia and their families. The Admiral Nurse Helpline has been going for some time and actually started around 2004, 2005. And at that time, Dementia UK was a very small charity based in London. And what they found was at that time, they were getting more and more inquiries, people calling them for general advice and seeking support in relation to dementia. In response to this, and I mean, Dementia UK was a really small charity at that time and probably employed around 10 to 20 people in total for the charity. And at that time, Admiral nurses working in the London area would offer their time and go travel to head office for a couple of evenings, and there was a nurse that worked a couple of days a week in it, and that was aimed to answer these, inquiries that came in. As this progressed and the inquiries were, still coming in, and that led to the official helpline launch in 2007. And you can see the pictures there of some of our lovely Admiral nurses around the launch time in 2007. At that time, the helpline was called Admiral Nursing Direct, and that was to be in line with the support service that was called NHS Direct at the time. And the official launch was in 2007. At that time, it was Admiral nurses working in London that travelled to head office because the technology that Dementia UK had didn't support remote working at that time. The helpline has been increasing in popularity, and we're seeing, especially during the COVID pandemic, we saw a really significant increase in calls, calling into the helpline. And it's now open 7 days a week, and the only day that it isn't open is Christmas Day. It's open 9 a.m. till 9 p.m. and weekends 9 a.m. till 5 p.m. And currently working on around 16 nurses per day shift working on the helpline. People can either call in, or they can email, or they can send online inquiries. It really has grown and developed, and it's fantastic to see how Dementia UK have first of all supported the technology behind the service, which means now that we have a remote working team, and I think we have nurses working at the very top end of Scotland all the way right down to the bottom of the country. So Admiral nurses working supporting the helpline, really covering a broad area of the UK. Um, Sometimes our helpline does get very busy, and in that, we work on a callback, and if people leave a voicemail, we call people back as soon as possible. So the helpline really has been shown to make, a real significant difference to people that are using this service. Our evaluation report from last year shows that we had over 30,000 contacts from the helpline, 80% of those being telephone contacts. And 30 or almost 40% of people have had more than one contact. So it shows that actually, once people have called the helpline, we are seeing that more and more people call back because they found the advice and help, useful at that time. On a friends and family, NHS friends and family test, 91% of the carers rated the service as good or very good. And that's, really exciting to hear. I think some of the main key themes picked up from the evaluation report from the helpline this year were the five real key things that were identified as striking of, the impact that the helpline is having. Firstly, enabling carers to advocate for the person living with dementia. We're seeing, especially over COVID, and ongoing issues with, people having difficulty accessing, their GP, issues around hospital care, issues around care homes. Often, people calling into the helpline are really looking, to seek advice and support to try and enable the person living with dementia to, to live as well as possible. Second of all, which ties into enabling the carers to advocate, is access and support. I think people with dementia and their families often can really struggle in knowing where to go, where I might get support, who might be able to help me, what services or support might be available out there. And on the helpline, we have a directory of services and a good idea, or, we're certainly able to try and help the person find appropriate support that they might need. Often people call in asking for, do they have access to a local Admiral nurse as well? Providing carers with confidence and reassurance, which is really important. I think often, carers can feel very isolated or, just be needing some guidance. And often it is reassurance, that you're doing a great job and these are the things that you're doing well. And trying to encourage the carer to, recognise what they're doing and have confidence in what they're doing. Issues around caring for the person living with dementia. So often that can be around understanding dementia, why the person might be behaving or communicating in ways that they are, and how we might be able to understand people living with dementia and understand the symptoms that they're experiencing, which in turn helps us provide appropriate support for them. And really importantly, we know that carers often, fail to meet their own needs, and often a significant and important role of Admiral nurses, and what's shown to be important on the helpline is encouraging people to recognise their own needs, significant care of stress, needing time for a break, and sometimes, talking that through with a person, because it can be very daunting for people to talk about, themselves and what they need. So a really important and striking theme that come through from the helpline. And we've had some, really positive feedback. And just to read you a quote that was shared to us from a carer's evaluation report from the helpline. Having access to the Admiral Nurse helpline has helped me enormously. I am and always will be truly grateful for the help and compassionate support I've always received each time I have rung. It was a priceless gift to be able to talk to somebody who understood the problems of dementia and completely understood what I was going through when I was screaming inside and feeling utterly desperate, like I could not continue living with such an intolerable amount of stress and fear. After every call, I felt totally supported, lifted up and strengthened, and able to carry on another day. So I think, I think I've just got her standing up on my arm already, just knowing that, the helpline is offering this support to people and often can be a really a lifeline for people who need that support. And anyone can ring in at any time. And I think it's, amazing that Dementia UK as a charitable organisation can offer that support to people throughout the country, which is fantastic. So I've talked a little bit about the helpline, and I hope that's given you an idea of the history of how it's developed and how it's grown, and the support that's offered through the helpline. And I would like to talk to you about virtual clinics. So the clinic model was initially piloted within Dementia UK in 2020 and started with regional clinics working in various places around the country that were lacking Admiral nurse support in those areas. The beauty about a clinics model is that many of the traditional community Admiral nursing roles and teams work within caseload management, which means that they hold a number of people, families, and work with them over a period of time. The difference with the clinics model is that people can come to the clinic and they are seen and then discharged. However, it doesn't mean, that the person can return as frequently as they need to, but it means that the Admiral nurse doesn't hold a caseload. So we're hoping, Dementia UK, we're hoping that by offering a clinics model, we could provide more Admiral nursing to support to more families and open up those doors somewhat to try and increase that Admiral nurse support. We know that not everybody needs a caseload management type style of support. Some people need information as and when they need it, especially as dementia is a progressive condition. The questions we have and the advice and the support that we need can significantly change over time, and we can have periods where people need, quite intense support, and then potentially, not so much. So I think the clinics model was really driven at trying to increase that Admiral nurse support for people across the country. It was really started in a partnership between Dementia UK and Leeds Building Society. And Leeds Building Society are one of our corporate partners that have funded a project. The virtual clinics offer a pre-bookable, so you can go onto dementiauk.org and book an appointment online, which means that, people can book a time and place that suits them. Often that's really good for carers, especially if they have to, they have planned times where they might be able to talk, and planning that appointment sometimes can help. It's a 45-minute appointment with an Admiral nurse, and it's either the telephone or a video call. At the time in which the service was started, was in the midst of COVID. So it really did help with sort of government guidance around social distancing, and limited any sort of travel concerns. It helps people to access the service who might have ordinarily difficulty getting out and about and meeting a nurse in real person. And it can also help with things like people who are in full-time employment, that might struggle to make appointments or get out of their, the place that they need to be at that certain time. It started off relatively small and, as increasing, and we're planning on increasing, continuing to increase the support. Initially, the clinic started up 3 days a week, but now it runs Monday to Friday every week. Two clinics side by side, so two Admiral nurses. One will support clinics via the telephone, and one would be via video call. And the appointments are on the hour, so 9, 10, 11, 1, 2 and 3. So we're able to offer 12 appointments a day and 60 appointments a week. And like I mentioned, appointments can be booked online at dementiauk.org. And I think we are now seeing that, the clinics are, really popular. And as Dementia UK are driven and focused on, increasing their support, we are looking at also increasing the 2 clinics to 3 clinics. So imminently we will be offering 1 video call and 2 telephone call clinics. We often find that the telephone calls book book up sooner than the video calls. It's not for everybody. Another great thing about sort of how the clinics model has developed and grown was that actually that the lived experience advisory panel, which we call LEAP, and they're a group of people living with dementia, or they're carers supporting people with dementia, who were really pertinent in the uh, setting up the service, and shared with us their thoughts and experience of the booking process, and the information, how they found the information, how the appointments are booked. So in collaboration with people living with dementia and their families, we hope that Dementia UK are offering a system that's easy to use, user friendly, and the website easy to navigate and find. So in virtual clinics, absolutely anything can come up, but certainly some of the common themes that we see are worries about memory problems and other symptoms that we might see of dementia. Lots of people interested in, information about how to get a diagnosis, what to do if the person with dementia is, not understanding or, lacking insight into their own needs and symptoms at that time. Understanding the diagnosis process, what happens after a diagnosis, and how the condition progresses. We see, that post-diagnostic support for people across the country is really patchy for people with dementia, and we find that lots of people on virtual clinics have received a diagnosis and are just really keen to to unpick their situation, plans for the future, and things that might be helpful um, around that time. As mentioned with Helpline, practical tips for caring for somebody who's living with dementia. There can be, practical advice around eating and drinking, washing, dressing, moving around, pleasurable activities, engagement, and things like that. Adapting and coping with changes in behaviour is an important part of, and I think it's both helping people understand why these changes are happening and thinking about coping strategies to how we might either reduce the behaviours that challenge, or try and prevent them, or coping strategies for when they happen. Financial and legal issues, we want to make sure that carers are equipped with, accurate information of, financial support that might be available, and lots of information and support around lasting power of attorney, which we know is really important, and advanced care planning. Lots of discussions around care options. Now, that might be care provision, starting that in the home environment, and it can also be transitions into care, respite care, and moving into a care home, which is a really significant and difficult time for a lot of families, and lots of people need support during that process and after that process too. And emotional support, I think, is often, really what people with dementia and their families are lacking, especially post-diagnostic, is that we know that lots of carers feel isolated, and often can be struggling, and having somebody to talk to is really important. Also thinking about anticipatory grief and the grieving process that comes along often throughout that journey of dementia, and bereavement and loss. And we certainly support people throughout the entire journey of dementia, whether it's when people are noticing symptoms and are worried about changes that they're seeing in their loved one, throughout, diagnosis, post-diagnosis, living with dementia, right up until the end of life. And then we are able to support people after a person has died, and that can be a really difficult time for a carer, especially, if their lives have been, significantly focused on supporting their loved one with dementia. When that person dies, it can be a real significant loss, and we want to support people throughout the journey. So Working closely with our insights and evaluation team who, they evaluate the helpline service, they evaluate the clinic service. Things that we've noticed from the evaluation reports are, improvements that people have expressed as adapting how the carer interacts and communicates with the person with dementia. Behaviour affects behaviour. So if we can try and help the carer to be able to communicate, both to understand the person with dementia and to be able to communicate back to that person can be really helpful. Implementing practical legal or financial actions and making decisions about care. Feeling, being reassured and confident to continue in their caring role is really important for people. Um, Helping to improve communication with other family and health professionals. Sometimes it can be really hard for carers to talk to healthcare professionals or even, family members about what's happening. And it's again trying to, to try and to equip that carer with information and knowledge that will help them to communicate with others and with the person with dementia. And recognizing that they need support too, similar to the helpline, it's, recurrent themes, is it really, we need to make sure that it's vitally important that carers are able to meet their own needs. And again, a significant focus is in trying to help the carer to work out what they might need and what support services might be available to help them continue in their caring roles. Some of the benefits that we know of from the clinics, greater understanding of dementia, feeling more able to and better equipped to take care of the person with dementia, better knowledges of services and support, increased ability to cope in their caring roles, ability to make decisions about the care of the person with dementia. It can be really hard when a person with dementia, has issues around making their own decisions, and then it falls on the shoulders of the carer too. And often people need that support to understand, what is in the best interest and what might be helpful in making decisions, both that are important for the person with dementia and the carer. And increases in a better ability to take care of myself as a carer, which is really important. And certainly, what we want to encourage is carers to be able to meet their own needs and seek that support as and when they need to. We've had some really fantastic, feedback from carers about how they've found the virtual clinic service. Um, Fantastic service. Being able to schedule the appointment around other commitments is so helpful. Knowing that you have dedicated time and space to talk is invaluable. I felt very comfortable discussing issues. I found it very useful to be able to book online that a time that I could pre-arrange to be free of distractions. And I thank you. Um, and I cannot thank you and your service enough. And I was worried about wasting someone's time. We're just concerned, my dad, and behaviour changes and memory issues. The lady I spoke to was immediately welcoming and understanding and very warm. She really understood our worry, my mum and my sister and I. She offered practical advice and next steps, but also offered further support for us and mum if needed. And again, that's how, certainly the clinics model, we don't continue to caseload manage. However, people can come back to us as and when they need to, and we certainly encourage that for people. So, I mean, that's some information about our virtual clinics. Like I say, all the information and to book a clinic appointment, you can find that information on dementiauk.org. I mentioned around the beginning of discussing virtual clinics that it was a partnership with Leeds Building Society. If I can take you back to pre-COVID, the initial plan with Leeds Building Society was to have a buzz or a mobile clinic unit that would tour the country and offer face-to-face support, Admiral nurse support for people in areas that may be lacking in Admiral nurse support. Dementia UK and Leeds Building Society, but as COVID happened and we weren't able to get the buzz on the road as planned, virtual clinics came about and it was all on a virtual platform. However, Dementia UK and Leeds Building Society were really driven to offer that face-to-face support. We know that virtual services are great for some, the helpline and virtual clinics, but for some people, face-to-face support is what is needed and what is preferred for that person. Unfortunately, we couldn't get the buzz on the road. However, again, how Dementia UK have responded to that is that, we didn't want that to stop us, getting out and across the country and offering these face-to-face clinics. So instead, as a different model to the buzz. Now what we do is, and this is part of my role, is that I work within the closer to home face-to-face clinics team, and we travel the country and we go and we provide clinics in the Leeds Building Society branches. So it's been fantastic to, offer face-to-face support in various areas across the country, and that we have a route planned up until April next year. So, and that information again can be found on dementiauk.org, and you can see, where we will be travelling to offer these face-to-face appointments. So the impact, people have been really appreciative. Some of the feedback that we've had from carers that have met with an Admiral nurse in the Leeds Building Society branch. You can see my colleague there, Jo, in one of the Leeds Building Society branches. The idea of meeting an Admiral nurse in a non-clinical environment made it more relaxing experience, more friendly and informal. And that was interesting. I think often, we when we think about nursing services, it can be considered to be quite clinical. So it was nice to hear that people are finding it comfortable to, have these clinic appointments in the Leeds Building Society branches. An invaluable service with much be continued. Best 40 minutes I've spent. Any concerns I had were quickly sorted and gave me lots of website addresses for further help. Just brilliant. And the nurse gave the most amazing advice about dementia, bank accounts, ring doorbells, visual timetables, and how to access some early onset dementia groups. So just some of the feedback about, how the on the road clinics are going and driven. So I spoke about the helpline, I've spoken about the virtual clinics, I've spoken about the closer to home clinics, and they are all encompassed in what we call the Dementia UK's core clinical services. Something that's really fantastic that's come from the clinics model is actually how adaptable the model is. So as well as having the closer to home clinics, which is the touring of the country with the Leeds Building Society, the clinics model has been adapted and used in other areas. So we have a clinic offered for the Professional Footballers Association. We have clinics in prisons, which is really innovative work from Dementia UK. We know that dementia support in prisons is not all that heard of, so it's something that we're keen on. We've provided clinics at the Alzheimer's show. We provide clinics at corporate partner events. We've had instances where clinics have been able to support local Admiral nursing teams where they've been having difficulties seeing everybody on their caseload. In London, we have a Chinese Welfare Trust clinic, and we have a Cantonese she speaks Cantonese and English. So really looking at actually how the clinics model can help with equity and diversity and supporting people living with dementia and their families from, underserved populations. And we also have a clinic for the Charity for Civil Servants. So I think the clinic model seems to be really taken off. It's adaptable, and we can use it in, lots of different settings, as well as our virtual platforms and being out on the road. Something that is crucially important is, how Dementia UK support Admiral nurses. We're well supported. Personal and professional development is, very important. So what happens for us is we have monthly group supervision where we get together and we discuss things as a group and bring cases that we might have found difficult, which really helps with our reflective practice and I think also because we often work remotely, bringing us together is really great. Um, we have our Admiral Nurse Academy, and lots of online learning platforms that we can use. We have an annual Admiral Nurse Dementia Forum, which is fantastic and a great learning opportunity and an opportunity for us Admiral nurses to get together. I mentioned earlier in the presentation that, when the helpline first started in sort of 2004, 2005, there was only around 5 Admiral nurses. And I think the latest head count is 420 Admiral nurses. So it's fantastic that Admiral nurses we're growing. Some Admiral nurses are employed through Dementia UK, through our core clinical services, and some are in what we would call hosted organisations, and that's where local authorities or NHS trusts employ the Admiral nurse directly. But it's a great opportunity for Admiral nurses to meet at the forum. We have special interest groups. Each Admiral nurse comes with our own interests and expertise and experience. So we have special interest groups which help with that. We have lunch and learn sessions, we have regular team meetings, and we have our consultant Admiral nurse team, and they offer us support. We have specialist support for young onset dementia, Lewy body dementia, frailty, and most recently sports and dementia. So again, through these consultant Admiral nurses, we can really, get specialist support for sometimes things that are outside of our remit. And last but by no means least, Admiral nurses, how we're supported behind the scenes. We, within Dementia UK's core clinical services, we have fantastic admin support. The admin, the emails coming through, the calls coming in, is really significant. And we certainly couldn't do it without our admin. We have fantastic IT support. Tech issues, unfortunately, come, and we're always well supported through our IT support, which means that, if we come into trouble and we have that support, that means we can continue offering that support to people working remotely through our telephone systems and on our online platforms as well. Marketing and communications, are vital in sharing the work that we're doing, and understanding where we need to, offer advice and support. Fundraising engagement is crucially important. Dementia UK solely relies on charitable donations. We have no government funding, and all of this fantastic work that Dementia UK are doing, we could not do it without funds raised, which is absolutely fantastic. And the fundraising team are doing a great job at, increasing the funds coming in to ensure that we can continue offer the services and support that we do. And the fantastic business development team. We know that through supporting people, increasing the knowledge about Admiral nurses in society, Dementia UK are driven, and as are, I think, everyone working within Dementia UK to try and get new services up and running off the ground, and to try and encourage people to to get local services. In fact, from closer to home, when we visited Sheffield, that's generated some interest in the local area about potentially adopting an Admiral nurse full time. So we know how, the impact of just visiting a city for a short amount of time can really generate that sort of local hunger and that desire to get Admiral nurses and continue with that provision and support. And we couldn't do that without the business development team. I'm not entirely sure what the total headcount is for how many people work for Dementia UK now. But I mentioned earlier that in 2004 to 2005, it was around 10 to 20 people. It's significantly higher now. We're growing. core clinical services are adapting continuously, working really hard. I don't think I mentioned insights and evaluation. Really important. A part of Dementia UK is that they're continuously evaluating and looking at the services, how we provide them, what we provide, what's working, and what can we improve on, which is vital in terms of making sure that we're, you know, we're doing what we need to do, and we're constantly improving. Um, that is a sort of a whistle-stop tour about the core clinical services. I hope that's given you a better understanding of the helpline, the virtual clinics, the closer to home services, and how Admiral nurses are supported within core clinical services. Any questions? Thank you.